Ministry of Public Health of Ukraine. Krok 1. Medicine. Year 2017. Number 057. A woman, who has been suffering from marked hypertension for 15 years, has lately developed dyspnea, palpitations, slightly decreased systolic pressure, while diastolic pressure remains the same. What is the main mechanism of heart failure development in this case? A. Damage to the myocardium. B. Cardiac overload due to increased vascular resistance. C. Disorder of impulse conduction in the myocardium. D. Dysregulation of cardiac function. E. Cardiac overload due to increased blood volume. Volume overload refers to the state of one of the chambers of the heart in which too large a volume of blood exists within it for it to function efficiently. Ventricular volume overload is approximately equivalent to an excessively high preload. It is a cause of cardiac failure. There is an optimum end diastolic volume at which maximum stroke volume and cardiac output is achieved. Beyond this, there is volume overload, and stroke volume is diminished. In this case, the woman has so large volume of blood that it exceeds the optimum end diastolic volume to achieve maximum stroke volume and cardiac output. The diastolic pressure remains the same and high in pressure, hypertension. The decreased systolic pressure is observed due to too large volume of blood in the heart to efficiently send the blood to the body. Hypovolemia is a condition where there is too much fluid in the blood. Excess fluid, primarily salt and water, builds up throughout the body, resulting in weight gain, whose symptoms include peripheral edema, ascites, anasarca, and pleural effusion. Small arteries diameter 0.2 to 1.0 mm and arterioles diameter 0.01 to 0.20 mm are involved in the regulation of arterial blood pressure as well as blood flow within the organ. These vessels are highly innervated by autonomic nerves, particularly sympathetic adrenergic, and respond to changes in nerve activity and circulating hormones by constricting or dilating. Therefore, these vessels are referred to as resistance vessels. Peripheral resistance is the resistance of arteries to blood flow. As the arteries constrict, the resistance increases, and as they dilate, resistance decreases. It is determined by autonomic activity. Sympathetic activity constricts peripheral arteries. Pharmacologic agents. Vasoconstrictor drugs increase resistance while vasodilator drugs decrease it. Blood viscosity. Increased viscosity increases resistance. The answer is B. Cardiac overload due to increased vascular resistance.